Hello everyone, I am Seema Gupta, working as Assistant Professor in Ramesh Institute of Vocational and Technical Education. I am discussing here the pathophysiology subject BP code 204T. This is lecture 12. I am discussing unit 2, the diseases of the heart. So, the today's topic is the myocardial infarction. Now, the different content that I am going to discuss with you in this topic of myocardial infarction is the definition, then etiology, what are the causes, etiopathogenesis, pathophysiology, clinical manifestations, complications, diagnosis, type of infarcts, location of infarcts, and finally the treatment. Now, the definition, see, myocardial infarction, it is also a type of ischemic heart disease. In the previous lecture we have discussed about angina, here we are discussing about myocardial infarction. It is a type of ischemic heart disease only. It is the infarction or the atheroma. What is the atheroma? The lipid deposition in the myocardium portion of the heart, which leads to ischemia, and if prolonged it causes death of the cardiac muscle cell. Okay. So, death of the cardiac muscle cell. Now, see, it is the infarction or the lipid deposition in the myocardial portion, the myocardium, the muscle portion of the heart. So, what happens when there is a lipid deposition, what happens, there is decreased in the oxygen supply also there, and ultimately what happen, the cardiac muscle cell is not able to contract, and finally it results into death of that particular tissue. So, infarction basically it is the dead tissue over there. So, what happens, see here in the diagram it is shown, this is the blocked artery. Why this artery is blocked? Because of the reduced blood flow is there, and there is a muscle damage. When there is a muscle damage in this area, the heart is not able to contract properly, leading to the disease leading to myocardial infarction. Now, etiology, what are the causes of myocardial infarction, how this myocardial infarction is caused. So, number 1 is the tobacco smoking. Tobacco smoking is a very important parameters. If a patient is under tobacco smoking, what will happen? It will definitely causes increase in the LDL level, and this will ultimately leads to the deposition of the cholesterol over there. Bad cholesterol is deposited and ultimately leads to the myocardial infarction. Then hypertension is one of the most important factors. Hypertension, that is the increase in the blood pressure, the blood pressure increases, and this ultimately it will cause the myocardial infarction. Then drug abuse, certain drugs that we are using. So, these drugs they are they causes decreased in the blood supply there. Then obesity, the patient who are less walking, very sedentary lifestyle the patient is having. So, that patient may also suffer from myocardial infarction. Then stress, of course, stress it leads to the release of certain neurotransmitters level, and ultimately it may also causes this disease. Alcohol is also one of the important parameters which may leads to the disease. Then the other factor is age. Age is very important factor, because as the age increases, the patient, their muscles they automatically they decrease, their contraction power decreases, and when there is a reduced blood supply also, obviously it may leads to this infarction. Then gender it is it is more prevalent in it is 3 times more prevalent in males than in females. Why? Because females certain hormones level there is more as compared to males, so more prevalent disease. Diabetes, patient is suffering from diabetes, again diabetes there is increase in the LDL level and there is decreased in the HDL level in case of diabetes, and so it will cause the it will ultimately cause the myocardial infarction. There is hyperlipoproteinemia, hyper increase lipoprotein, the same is the increase in the LDL level is lipoproteins, they are more, ultimately it leads to the blockage of the coronary artery, and finally the leads to this ischemic heart disease, the infarction of that particular muscle cell and leading to myocardial infarction. Then family history of ischemic heart disease, if there is a parent is suffering from ischemic heart disease or the infarction, a parent is suffering, the child or the progeny they may suffer from this disease. Then last is the chronic kidney disease, if patient is suffering from the kidney disease, then also the patient may suffer from myocardial infarction. Now, etiopathogenesis is the cause and the development of the disease, how the disease is developed. How? Atherosclerosis, it is hardening and stiffening of the arteries, that may result into infarction. Then myocardial ischemia means less of the oxygen supply to the myocardial portion and that ultimately leads to ischemia. Then the role of platelets has very important role. Okay. So, the role of platelet is there, the continuous accumulation of the platelets, it may leads to the myocardial infarction. Non-atherosclerotic causes में the number one is coronary vasospasm, the coronary artery it constrict. Okay. So, when the constriction of the coronary artery, vasospasm, constriction, so the blood supply reduces in the portion of coronary artery. When the blood supply reduces, what will happen? It may lead to ischemic heart disease, and finally, the portion of the myocardium, that the tissue there is dead, so leading to infarction. Then trauma, certain injury. Okay. So, injury may also lead to the development of this disease. Now, pathophysiology, we will discuss the role of platelets, how platelets is causing the thrombosis, how platelets is causing accumulation, myocardial infarction. So, what was happening? The rupture of atherosclerotic plaque. When there is atherosclerosis or deposition of the cholesterol is there first of all, then that cholesterol it ruptures. After that what happens? It exposes the subendothelial collagen to the platelet. What does this means? Subendothelial means the cells which are present below the endothelial lining. Okay. See, you know the blood vessels is there, this is blood vessels, this is the endothelial innermost layer, endothelial layer. Okay. Then below this is subendothelial. This is subendothelial layer. Now, what happen when there is a, this is the plaque deposition over here, suppose this is the plaque deposition over here. So, what happen? This in the subendothelial layer, the collagen which is present, this collagen accumulate, and this collagen it causes activation of the platelets. Finally, there is build up of platelet mass, it accumulates, and this causes it initiate the thrombosis. Okay. Now, coming to clinical manifestations, it means what are the sign and symptoms. So, what are the different signs and symptoms that is associated? So, number 1 is the chest pain, discomfort, dyspnea, that is the breathlessness, decreased in the breath, fatigue, tiredness is there, then increased sweating, weakness. Your CTZ may be stimulated, that is chemoreceptor trigger zone which is present in the brain, that is stimulated, and ultimately it leads to nausea and vomiting. Then lightheadedness, and finally palpitation. Okay. So, these are the different clinical manifestations or the clinical sign and symptoms. Now, coming to the complications. Complications means if a patient is suffering from this myocardial infarction, what other disease he may also suffer from? Arrhythmia. Arrhythmia, what is arrhythmia? It is the irregular heart rate. Irregular heart rate. So, irregular heart rate, what does this means? If a heart has particular rhythm in which it contracts. If it contracts very fast, so that we called as tachycardia. If it contracts very low, very slow, we call it bradycardia. So, that is what arrhythmia is. So, if a patient is suffering from myocardial infarction, he may also complications of arrhythmia may occur to him. Then cardiogenic shock. कार्डियोजेनिक शॉक का मतलब है कि suddenly there is a shock condition and the heart is not able to pump the sufficient blood. So, certain such condition may occur to the patient. Then is the congestive heart failure. Congestive heart failure, the heart is not able to pump proper blood to meet the body demand. Thromboembolism. See, thromboembolism, thrombos is basically, this is the stationary clot, stationary clot, okay. This is called thrombus, and emboli, it is a moving clot. So, in thromboembolism what happens? If suppose this is the coronary artery, here is the stationary clot is there, this is the thrombus, this is the stationary clot is here, and here is the branches of the coronary artery. If this clot is moving, this is the clot, if this clot is moving here, it will completely occlude this blood vessel. This is called your emboli. So, patient may also suffer from such disorder that the clot is moving into the branches of the coronary artery, and in the narrow branches, if that clot is moving, it will completely obstruct that blood vessel. Then is the cardiac aneurysm. Cardiac aneurysm is sudden bulging of the blood vessels. Okay. So, that may lead to create a pressure there and may lead to infarction. Then pericarditis. Pericarditis is the inflammation of the pericardium. Okay. So, that may lead to the myocardial. So, this is the complications. Okay. A patient is suffering from myocardial infarction may after some times get pericarditis, inflammation of the pericardium. Diagnosis. How you will diagnose the patient is suffering from the myocardial infarction? What are the different parameters you will judge for a patient? So, number one parameter is the pain. You will see that the patient is having very high pain. Then the second parameter is indigestion. Third clinical features is shock. Then oligouria. Oligouria, it basically here means the less of the urine. Okay, these are the clinical features, sign and symptoms when a patient is suffering from this myocardial infarction. So, oliguria, that is decrease in the urine. Then there is a low grade fever. Okay. These are the different clinical features. Then what are the ECG changes? ECG changes, see, ST elevation or T wave inversion. Normal ECG you have seen, this is P wave, this is Q, R, S, T wave. This is the normal ECG. ST elevation occurs in myocardial infarction. ST elevation means here in ST elevation what will happen here, this type of a little bulge is there. This is called ST elevation. Okay. So, in ST elevation is here or T wave inversion, this is the T wave. Okay. So, this T wave may be inverted. Okay. So, these are the different ECG changes that we have seen. Then the serum cardiac markers, different serum cardiac markers judges that a patient is suffering from myocardial infarction. If in the serum there is increase in the level of this enzyme, creatinine phosphokinase, this is an enzyme. If there is increase in the level of this enzyme, it indicates the patient is suffering from myocardial infarction. Or myoglobin level, it also increases. Myoglobin level increases. Other enzymes like troponin level is a very important marker, because it automatically indicates that patient is suffering from myocardial infarction. See, because of the death of the muscle tissue, there is a death in the cardiac muscle cell. So, when there is a death in the cardiac muscle cell, certain enzymes are released. As a result, there is increased level of these enzymes, increased level of myoglobins and all. So, which is a clear markers, it indicates the patient is suffering from myocardial infarction. Now, different types of infarcts. What are the different types of infarcts? See, infarcts, they are classified into the following types according to the anatomic region of the left ventricle where the infarcts they are present in the left ventricles. Anterior infarcts, they are present in the anterior portion of the left ventricle. Then there is a posterior infarct which are present in the posterior portion of the left ventricle. Lateral infarcts, they are present in the side portion of the left ventricles. Okay. Like suppose this is your heart, this is the left auricle, left ventricle, right auricle and right ventricle. Now, we are talking about this portion of the left ventricle. Okay. So, the lateral is present over here, this is called the lateral infarcts. Okay. Anterolateral infarcts, anterolateral means they are present between the anterior and the lateral position, anterolateral infarcts. Posterolateral infarcts, they are present between the posterior and the lateral position. Then according to the degree of thickness of the ventricular valve involved, according to degree of thickness of the ventricular valve involved, the infarcts they are classified on the two types. Number one is the transmural and number two subendocardial infarcts. Transmural infarcts, this transmural infarcts, this involve the whole portion of the ventricular valve, the whole portion, the entire portion of the ventricular valve. So, transmural infarcts what happen? It involve the entire portion of the ventricular valve. Subendocardial infarcts, it involve only the below the endocardium layer. Okay. So, sub is below the endocardium layer, the infarcts they are called as subendocardial infarcts. Then according to age of infarcts there are acute, recent and fresh infarcts. Acute, recent and fresh means they are just only developed there. Then is the advanced infarct is there. Advanced infarcts is for they are accumulated for a very long duration of time. So, that is called this advanced infarcts. Now, location of the infarcts, see basically the infarcts they are most frequently located in the left ventricles and the right atrium. Why? See, in the left ventricles the muscle layer of the left ventricle is more thick as compared to the right ventricles. The muscle layer when it is more thick, it means more of the oxygen is required. So, that portion will be more affected. Left ventricles they are more affected. And the right atrium is also more affected because the deoxygenated blood is present in the right atrium. Whereas, the right ventricles and the left atrium are less susceptible, because in the left atrium the oxygenated blood is there, in the left auricle the oxygenated blood is there. So, they are more prone, they are less prone to the infarct. Okay. Now, region of the infarct it depend upon the area of the obstructed blood supply by one or more of the three coronary artery branch. See, coronary artery wherever it branches, now whichever branch is occluded, that portion is infarct. That like a coronary artery supplying blood to whole of the heart. So, whichever portion of the coronary branch is occluded or blocked due to deposition of atherosclerosis, so that portion only may there is a location of infarct in that portion only. Now, location of infarcts, stenosis of the left anterior descending arteries, stenosis of the right coronary, see stenosis means narrowing of the artery. Okay. So, if there is here they are showing the stenosis of the left anterior descending arteries. See, you can easily see here like how there is blockage of the left anterior descending artery. This is the area, this location left anterior descending arteries, or there here is shown here the blockage in the right portion. Okay. Or there is a stenosis in the left circumflex coronary artery, the artery which is surrounding. Okay. So, depending upon the location of the infarcts, the patient may suffer from the different types of infarction. Now, finally coming to the treatment. See, treatment, immediate care to provide pain. Immediate care means if a patient is suffering from myocardial infarction, first of all what you have to do, you have to provide pain, you have to remove that pain to that patient. So, immediate pain, how you can remove? Morphine is given for that. Okay. So, when morphine is given, the pain subsided and it further prevent the deterioration. Okay. Then management of complications like heart failure. Management of complications, if patient is suffering from heart failure, that you have to maintain. Arrhythmia, that you have to treat that arrhythmia. Heart failure if there, that you have to treat the heart failure, the complications, the disease, the drugs you have to give for treatment of those complications. Then time of the treatment is very important in myocardial infarction. If 6 hours, if within the 6 hours the patient is taken to the doctor and the drug therapy is given, the patient is treated, the disease is reversible within the 6 hours. After 6 hours it is irreversible. So, time of treatment is very important in case of myocardial infarction. Finally, coming to the other parameters how you will treat. So, first of all is thrombolysis, the different drugs which are given. Thrombolysis is the breakdown of the thrombus. How you can break down of this thrombus? By the different drugs called antiplase and streptokinase. They causes lysis of that thrombus, breakdown of that thrombus. Then antiplatelet drugs are given. The antiplatelet drugs like aspirin and clopidogrel, they are given. They break down the platelets over there. Because of that platelet accumulation, there is it is leading to myocardial infarction. Then angioplasty is done. Angioplasty, what is angioplasty is, see angioplasty, first of all angiography is done, the location of the infarct or location of the blockage is seen. With the angioplasty, the area where there is a blockage, the stent is provided in that area and the further accumulation of the clot is not there. Okay, so, angioplasty is a bit operation where a catheter is inserted through your wrist area or your groin area, and a ballooning is done first of all, and finally, the stent is added. So, that is the angioplasty, and heparin therapy is given until the patient is stabilized. Of course, this is the very important therapy. So, that is all for the today's lecture on myocardial infarction. So, in the next lecture we will discuss the next disease related to the cardiovascular disease, and that is all for the today's lecture. Have a nice day. Thank you.